So, and we just jump right on those quadriceps. I know we need to mobilize the ankle to make it feel better, but definitely the quads work have to be done.
I had an ankle injury when I was young, and I was jumping off on these bars, on the horizontal bars, and I landed really hard, and it froze up that ankle. So I've had that ankle problem since I was 12.
You see? So what we're doing here, we just slowly work on that quadriceps. That's rector femoris muscle. A lot of people start working on IT band. I not touch IT band because it's painful and it's not do anything because it's a tendons.
Right.
You can work on tensor fascia latae, which is right on the top of the insertion of the muscle.
Yeah.
So you can work on that part, but definitely not on IT band. I see a lot of people lay down and try to stretch with a foam roller. It's definitely not a good idea because you don't do anything without it.
They do it all the time.
Yeah, they do it all the time because they see on the video everything what they like. So much stuff up there on Instagram, Facebook, and people don't know what they're doing. They don't have degrees, and they just show whatever because someone showed them too. This is how people learn those days. Learn from professional. Learn people with experience.
It feels very tired in there, very tight and tired.
As you can see, I don't use much oil because I want to stay on that muscle, and I'm really follow. This is my fast speed because I'm for the camera purpose.
Yeah.
We're gonna stop the video right now and just work another 5-10 minutes. But this is my speed. You can use your knuckles. You can just apply, be careful. You can pull like this side.
Yeah.
If you're a female and you work on the male, you can put some towel up here. Let me show you how to do that. You can just roll it and you feel safe, the guy feels safe.
Yeah.
You tuck it in up here. So you protect yourself.
Yeah.
You see? So you're right in here.
Yeah.
Always communicate with your customer. Tell them what's gonna happen next. If you want to put this muscle in stretch, you can just bring on the side and drop away from the table. Now look, everything is pop up here.
Yeah.
What I'm doing, I watch on his face. If you're gonna make faces, that's mean he's in pain. I don't want that to happen.
No,
I want the person to be relaxed and feel comfortable with my touch. If you make person in pain, guess what? His brain start guarding everything, and he can't relax. So painful massage is not an option.
It tenses up, the client tenses, locks it up.
Yep,
Guarded.
It's like security system in the bank. If you go too hard, too much, it's lock it up and you're not gonna get anything you want. But just very slowly. Like I said, I'm going fast because the camera.
Yeah.
Also, you can work with your forearm, and this is really nice technique. So you grab the fascia, you see, because if the oil, you're probably not able to grab that fascia. And what you do, you just slowly, this is my speed. I feel his body telling me when I should move forward, and his body let me move forward. I'm stuck, I'm not going anywhere, I'm just stay here. And he's breathing. Don't tell the customer breathe because he's like focusing on my touch right now. I want him to focus on his breath. And this is my speed.
That's good.
So, palms, fingers. Fingers is like for probably beginners because after 5 years it's gonna hurt too much. So I use my knuckles, I use my forearm, I use my palm, everything. But not, you can use your thumb just like that, spread this, separate that muscle. And you go all the way up to this ilium, anterior ilium bone right there, and you finish that.
Wow.
You can also come here, you can grab and shake it up. Grab and release. Grab and let it go. You got to lift it up. Also, you not forget to work right below that patella because remember this is attachment. And I'm just place my thumb and I'm gently just do deep cross fiber friction. Just work on that patella around. Okay, I'm not pushing on the patella, I'm not pushing on knee. It's really have to be careful. Work around those attachments, and this is how you work on those quadriceps.
Wow.
Okay, so we keep working on the right leg, and we're talking about this ankle mobility. So I'm definitely gonna work on this talus area, tibialis muscle. I just wanna make sure he's nice and not restricted. What I'm gonna do, I'm gonna ask him to dorsiflex this foot, and you can see it's not going far. You can see this muscle is pops up, and what I'm doing here, I'm really work on this tibialis muscles. So you can use as a tuning fork. We show this video too much, so many times. Probably have 56 viewers, which is great. And you can also use your knuckles. I don't push on inside side, on medial side. I use lateral more side than medial. And what I'm doing here, you can cross your fingers together, you can put it like just like that. And there's two thumbs just guiding on that tibia bone. And what I'm doing, I press with my left knuckles kind of down, and I go all the way up to this knee. Also, you can apply your fingers right in here and ask him to dorsiflex this foot, and you just work on that. I'm standing usually this way, but just make sure you're gonna see in the camera. And what I'm doing here, yeah, right there. Very slowly, very nice move.
This has been tight since I was 10,
Here we go.
12 years old.
Yeah.
Should I bring it up and down?
Yeah, I'm gonna help him out. If person can't do that, you can apply the band, and this is what we're going to do. Right there, he's feel it. Yeah, I feel it too.
Yeah. Oh my God.
Yeah.
Wow.
Yeah, you can also use your knuckle. You just stay up here and apply the pressure, and David start moving his, yeah, right there, up and down. Make sure he's not in pain. You okay?
Yeah. It feels good. It's like very sore, but it's good.
Yeah, and I feel it start moving.
Yeah.
So whatever this is not working. I see this European guys, they have a championship with they do whatever that mean. I don't know, whatever. This is I don't know how to call it. I think it's yeah, it's
exercise,
like nice like blood flow, bring some blood flow, yeah, but you need to work deep. You need to break all those years and years that's been built up, not functioning.
Wow, it's tight.
Okay. So now we work on that muscle. Now what we want to do, we want to restore that movements. We want the brain to think these movements again. What we're going to do, let me go grab that band. So what I want to, David, go ahead, sit down. I can bring him up. And this is his homework. He's going to take this right in here, grab it, and start like pull it up, resist it. So you can grab more if you want, right in here. And what I want you to do, just start, moving this foot up and down. So release, and you're gonna feel in your hamstring, and it's probably like a minute and a half. So just pulling and resist, hold it. You can bring up here, hold a little bit, and let it go. And if you're a therapist, you can help him out, and you can feel that pop right there.
Yeah.
So we restore that movement. We restore the dorsiflexion.
I had an X-ray. Everything is normal on the X-ray, so it's just soft tissue problem.
Perfect. It's also the pattern problem.
Yeah.
There we go. So you keep doing that. How's it feel?
It feels good.
Keep moving. Don't move your body. Just your leg. Huh? Try. You see? And he's kind of, yeah, you can put it right here. Make sure it's not going to take it off and slap in your face. It's happened before. So yes, you're moving. Slowly hold it right there. And now you can hold and start moving up and down. Yes, right there. Put so much tension. Yes, that's what I'm looking for. And I can, when he's done doing this, I can also apply that pressure. And this is like, boom. This is the key right here. So always have those bands close to your table. And yeah.
So it's not the calf as much.
It's also
this, all of this. This feels really good.
Here we go. And let it go that band and see. Just try without band and see how you feel. You see how this ankle is working now?
Yeah, it feels better.
Exactly. So feedback. The band is a feedback. It's get this impulse to your brain to operate better and activate the muscle what's been sleeping.